Now I'd like to invite on stage Senator Sherrod Brown. Senator Brown's home state of Ohio is also witnessing the devastation caused by the opioid crisis. In response, the senator has called for a national public health campaign that will target the epidemic by developing strategies that range from prevention to recovery. As a former public school teacher, Senator Brown also brings a unique perspective on how the opioid crisis is impacting adolescents. Welcome, Senator Brown. The Hill's editor-in-chief, Bob Cusack, is back for this conversation. Bob, over to you.
Thanks, Diana. Thanks, Senator. Join us. As Diana mentioned, you have called for a major public health campaign to combat opioid addiction, similar to the anti-smoking programs. Can you explain why you think this is a very good approach to follow?
Yeah, we as a nation are not. We're not thinking big about opioids at all. I mean, it's state governments that have largely been inadequate in their addressing the opioid problem. It's a federal government that will never spend money on anything except to give big tax cuts to the richest people in the country, and in robbing or taking away or at least undercutting our ability to do what we need to do. At the same time, you have a Congress that is, I mean, if you know anything about medicine, it's first do no harm. You've had a Congress for 15 months and a president that's trying to rip Medicaid away from, in my state, there are literally 500,000 people that have gotten Medicaid that have insurance for opioid or other mental health counseling. That much of that would be jeopardized. So you start with that. But in your question, Bob, I think if you look back in this country's public health history, I wear on my lapel, it's a depiction of a canary in a bird cage. The mine workers took the canary down in the mines 50 or 100 years ago. In those days, a child born, because the mine worker had no union in those days, strong enough to protect his safety, and almost always his, and no government that cared enough to protect his safety. He was on his own. And in those days, a baby born in this country would live to be 45, 46, 47 years old on the average. So we, over time, government has engaged in a big way in public health, whether it's Medicare, whether it's Social Security, or safe drinking water, or clean air, or civil rights, or prohibition of child labor. Well, in the best example that you touched on is in the 1960s, I believe 64, 65, the Surgeon General, Dr. Terry, for the first time government engaged in the issue of tobacco. And in those days, 45% of adult Americans smoked. Today, because of government working with local communities, and I know we're in an era where it's popular to always say government doesn't deliver on things, but clearly that's just not true. And from the 1960s to now, that 45% of adults smoking is down to 15%. And that would not have happened without addressing. You can look at auto safety, measured by number of drivers, measured by number of passenger miles. It is so much safer to drive on America's highways, partly because of engineering by state departments of transportation and local communities, partly because government said you're putting in airbags, you're putting in seatbelts, you're going to make cars generally safer. And we did it with HIV/AIDS, even though we had a government in the 80s, early 80s, that would not even acknowledge that HIV/AIDS wouldn't acknowledge much of anything about its being a public health crisis. And so when we tackle things, even Ebola a couple of years, 4 or 5 years ago, you ask people, how many people in America contracted Ebola and died of it? And you would hear all kinds of numbers. The answer is 0. And it's 0 because the CDC and public health officials did something. We have neither a president nor a Congress that either wants to do this or knows how to do this in a big way. Other than happy talk, we're not really addressing what we could do in a dramatic, comprehensive way to deal with this. And I come from a state, I know Senator Capito was here earlier. Right. Her state, I believe, has the highest per capita death rate. Mine has the second or third highest, and the highest number of people, 11 people died. On the average, 11 people died yesterday, 11 people died Saturday, 11 people will die today, 11 people will die tomorrow. I mean, think of that. And most of them in the prime of their lives.
What are in your state on the ground, what are the education programs, and when should kids start to be educated on the dangers of opioids and fentanyl? What needs to be done at that level?
Certainly a lot. And I'd start with this. About 20 years ago, Cincinnati Public Schools and they become a model for schools, superintendents, teachers, others will come to Cincinnati and sort of look at what they do in virtually every school building where they do sort of wraparound health services. Wraparound in the sense of you don't just have a school nurse, although we've because of underfunding parts of government education, we don't have public school nurses in nearly enough schools anymore. But in Cincinnati, they do these wraparound services. So it's more than just having the school nurse. It's having counseling. It's having embracing parents and grandparents and family members on how to deal with all the problems, everything from lead-based paint at home. My wife and I live in Cleveland, a zip code 44105. That zip code had more foreclosures than any zip code in America in 2007. You still see the devastation in my neighborhood. I asked the Cleveland Public Health Department one time of the homes in Cleveland, and this could be the case in every industrial city in America, in every small town in Appalachia, of the homes that were built prior to 1950, how many of them had toxic levels of lead paint? And he said 99%.
900.
And we don't, I mean, these are all public health issues. The Cincinnati Public Schools is trying to do sort of wraparound services. So that's been sort of the model. It wasn't about addiction back then. It was about a lot of other things. But it is now, and we have a school in New Albany, a wealthy suburb that's looking at doing some interesting things. We have a school in Columbus that's beginning to form, that's focused on, likely as it's up and running, will focus on people of all ages, children of all ages from K through 12, I believe, or at least high school, I'm not sure, that will all the students will have had some addiction challenges. And you, of course, have the issue of grandparents raising grandchildren because of death of parents or incapacitation of parents. And the schools need to address all these social problems that perhaps 20, 30, 40, 50 years ago, I think we romanticize the past a bit, but perhaps didn't have to address those things as acutely as we do today.
Mm-hmm. Now, you mentioned Medicaid and the Trump administration, and I imagine it wouldn't be a good grade, but what kind of grade would you give the Trump administration in dealing with opioids?
Higher than I'd give their EPA director. That's not really the answer we're looking for. Okay.
A lot
kind
higher,
of
or a
funny.
little
Some
higher?
people laugh. I think that. I mean, I think they've done a little better on that than they've done on other. But I mean, again, the first thing is do no harm. When you attack Medicaid and you criticize, I mean, the Ohio Republican governor expanded Medicaid. There is not there is no Republican elected official right now in Ohio that I've heard, possibly somebody's doing it, in all the legislative, that's really giving a spirited defense of Medicaid expansion with the Republican governor still in office. Mm-hmm. The candidate for governor is, the one candidate for governor, his lieutenant governor attacked Medicaid expansion. His lieutenant governor with whom he ran attacked it. The nominee who beat her in the primary, the attorney general, is sort of not taken a position yet what he's going to do. So you can't give the president a very good grade when he's attacking Medicaid and most of the Republican majority. And I don't mean to sound partisan, but how do you not sound partisan when one party has dedicated itself to one party with a bunch of elected officials that all dress pretty well, that are provided insurance by all of you as taxpayers, thank you very much, how their mission through the first calendar year of this Congress was to take away people's insurance. And these are people, I mean, think about this. I was in Cincinnati at the Talbot House, which is a really long time, really good social service agency in Cincinnati. And I sat next to there was a man sitting here that was more or less my age, and there's a woman sitting next to him. And he put his hand on her arm and he said, "This is my daughter. She'd be dead if it weren't for Medicaid." She was in her early 30s. And I just, I'm just incredulous that anybody thinks it's right to do that. So I think he's made some good speeches. I think he's getting some involvement, but it's got to be, and I don't blame just him, but Congress, all of us have to look at this in it's the biggest public health problem we've faced, I don't know, since polio. I don't know, maybe bigger, maybe not bigger, but it's a huge public health problem. And we just simply aren't meeting it. We aren't meeting it with the bluntness and plain-spokenness and dollars that we need to.
Well, speaking of Congress, CARA 2.0 legislation, I talked to Senator Capito about that. Can that get done between now and the election?
Yeah, I think a number of things are getting done. My colleague in Ohio, Senator Portman, Republican, he and I have worked a lot on this. He's been very involved in this issue, a good leader in this issue. Senator Capito and I have a couple of bills, more interesting. One is taking off a group in Dayton, a treatment center for particularly for newborns who have been born, who are born with whose mothers were addicts, that called Bridget's Path, which does a really good job. And one of them is to sort of help expand those kinds of acute care facilities. The other is the government right now. We spend a lot of money on job training. We spend a lot of money on opioid treatment and other mental health treatment. The problem is somebody comes out of treatment, they're clean, but they can't find a job. And if they can't find a job, the chances that they're going to downward spiral obviously are much greater. So why don't we combine those? So you come out of treatment, you're getting job training as you're in treatment. You come out of treatment with a skill that you can then translate into a job. Because the problem of just when they stand alone is you got the first problem of when they're clean, they can't find a job. You have the other problem, they get training, but they can't pass the drug test. So our bill will simply pull that together. Not simply, because there are two programs that have, two areas of programs that are complicated each of themselves, but there are ways to do it.
We're going to open up for questions. If you can stand up and also identify yourself.
Hi, thank you for being here, Senator. My name is Shivam Shah. I'm from Cincinnati, and I'm a medical student in Ohio.
God, I'm glad I mentioned Cincinnati like 3 times.
So we heard from Senator Moore discuss healthcare provider incentives. So what upstream efforts are there in Ohio to change prescriber behavior to tackle this issue?
To change what behavior?
To change prescriber behavior.
Prescribing behavior. Good question. Many of you, I assume because you're here, a number of you have read Dreamland, which was unfortunately featured 2 communities in a big way in my state, Portsmouth, Ohio, and the river, down southern Ohio, that's almost the southern tip of the state, and Columbus, the capital, where much of this happened. And you could see how much of this epidemic or public health disaster came out of the misreading or the misinterpreting on purpose of drug companies and the likelihood of addiction from OxyContin and oxycodone and Percocet and Vicodin and that. And it was a letter to the New England Journal of Medicine written by a doctor with no studies, just simply saying the addiction rate's only 1% if you take opioids. What they spoke to was the addiction was 1% if administered in a hospital, and you don't take a bag of pills out when you leave. That's not the way the drug reps for Purdue and others sold it, and talked about that study that wasn't really even a study from the New England Journal of Medicine letter to the editor. And we can point a lot of fingers, as I just did, and there should be accountability, and there's a huge case in the Federal District Court in Northern Ohio, Judge Polster in Cleveland, that's trying to sort all this out of who pays what and where do those dollars go and what do we do to scale up treatment. So I think there's a lot more attention paid to the medical community, those that overprescribed. We all take blame. Congress came to this late. All of us could have seen this earlier probably than we should have. So I don't, other than Purdue and what they did, I don't really want to point fingers in a non-constructive way. But I think that we're moving in that direction. I think that I've had conversations with Secretary of HHS and the Obama administration about this. They were moving in that way. I think the Trump people have continued it to make sure that doctors are doing what they ought to be doing now. But sort of complementary to that is scaling up both clinics and various kind of mental health services and training more doctors and nurses and other practitioners, mental health counselors and other, to everything from prevention to medication-assisted therapy to know what to do that way. And we're behind there because we didn't come to this early enough and because there weren't the dollars to do it. But we clearly need to do both. Thank you. Good luck at UC. Thanks.
Hi, Hi, Maureen Elias with the Veterans Health Council of Vietnam Veterans of America. One of the things I haven't heard discussed yet is opioid withdrawals. And as someone who has been through the agony of opioid withdrawals firsthand, I'm wondering, there's a new medication the FDA just approved called lofexidine. It's a non-opioid, non-narcotic withdrawal relief medication. I have this belief that that there are unintentional addictions that occur when someone is coming off of opioids because either they mistake their pain returning for the withdrawal, or they realize the withdrawal is so bad they stay on the opioid to avoid withdrawal. What kind of role, from a public health perspective, would a medication like this play in reducing unintentional addictions?
I don't know. We err in fashioning, we as public officials err in fashioning ourselves as experts on medical issues where we shouldn't think of ourselves that way. And I'm on the Veterans Committee and worked a lot with the VA less on withdrawal than addiction and suicide rates and some of those things, but clearly that's part of it. And there were certainly cases of VA doctors overprescribing, as there were sort of across the board. Maybe it's more tragic with the VA for other reasons and VA homelessness and all that. But I'm willing to learn more about how we do that. I think you raise the issue of pain medication, not the withdrawal side of it, but pain medication that's less pain management. I'm sorry, not pain management that's non-addictive. And I think we are, as a public health community, as many physicians, as the VA, are looking for other options other than just prescribing OxyContin. So that's a big part of that. But I'd love to learn more from what you're doing. And if you wouldn't mind, the woman in my office that works on these issues is named Anna, Gokaldas, Gokaldas, and she'd love to hear from you. Thank you.
I think we've run out of time. Please thank Senator Brown for coming here this morning, having this great conversation. And I hand it back to Diana. Hey, thanks so much, Senator.